Hello, Instagram family. It's Dr. Tamara here on Friday afternoon, and we have reached number 10 of our little online webinar series through Instagram. So if you're jumping on now, welcome. We have had an amazing 3 weeks. I'm actually just reflecting on all the things that we have looked at over the last couple of weeks. Let's have a look here. I've got my little calendar. My little calendar's here. What have we looked at? We've looked at busting 3 myths around fertility. We've looked at first line testing. You guys all got the opportunity to meet one of my dearest patients, Amy McHugh, who shared her story about playing the long game. We looked at 5 things you needed to know about preconception carrier screening, things to know about male infertility factors. We did a rapid fire Q&A, which was massively rapid. We did 5 things you needed to know about egg freezing. On Monday, we had a chat with sexologist Melissa Hadley Barrett, talking about all things sexual health while navigating the fertility journey. We had a beautiful little interview, kind of last minute spontaneous, on Wednesday night. If you want to go back and check that out, you can. And we've reached our last one, 5 questions that I often get asked in the context of secondary couple subfertility. So if you want to go back and have a look at any of those other webinars, you can jump on my Instagram. You can go to the video section and they are all there. So let's talk about all things. Now, this is me with my extraordinary skill set when it comes to, oh, look, there we go. 5 questions about secondary infertility. So I sat down and had a really good think about, well, what are 5 of the most common things that I actually get asked in the context of secondary couple infertility? And I guess I'll talk to each of those in turn. So the 5 questions are, well, what is secondary infertility? The second thing, if I've had a child or I've had other children, should I be okay to have another one? What are some of the possible causes of secondary couple subfertility? How long should we keep trying before we seek assistance? And where do I go? What do I do about getting some assistance? So I think the very first thing to really understand is that secondary couple infertility is when you and your partner, so the same partner, so kind of what you need to understand is that it all starts again if you've got a new partner, right? So this is when you're with the same partner as you were for your previous children, who you had no problems falling pregnant with. There were no problems with conception with your previous child or previous children, and now all of a sudden you are struggling to conceive for this next child. That is called secondary couple infertility. A lot of people get confused with the fact that they might have conceived via IVF or they might have conceived via ovulation induction previously, and now they're struggling to conceive spontaneously subsequent to that pregnancy. That is not secondary infertility. Secondary infertility is something that has happened in the interim between you easily conceiving previously and now. So it's really important to get that definition actually clear. So it kind of brings us to that next question of, well, if me and my partner, we've not changed, if we easily conceived previously, then surely we should be okay to conceive again. Well, I guess that's certainly a possibility, isn't it? But it might be that either you or your partner have acquired something in the interim between the first pregnancy and the last one that has now contributed to your inability to conceive. Or perhaps there was something already pre-existing, and in fact that first pregnancy was somewhat of a bit of a miracle. Perhaps you played the probabilities and you actually scored it, and in fact now the probability of falling pregnant spontaneously is weighing against you. Or maybe there has been some pathology that was kind of grumbling along and now it's reached a bit of a tipping point enough to now impact on your ability to conceive. So just because you've easily conceived of your first child or your second child doesn't mean that you're naturally going to be able to easily conceive of the next one. So it is possible to have issues where you had no issues before. Okay, there are, I guess, some reassuring things though, and this is often what I talk to patients about. It's reassuring that if you and your partner have an egg and sperm actually reaching each other, that you can fertilize, because that bit kind of has been proven. It also is reassuring that you've been able to create an embryo that can implant and carry through to a pregnancy or a live birth. So those things kind of do weigh in your favor when you're experiencing difficulty for a subsequent pregnancy. So I think it's always really important to kind of hold hope in the fact that some of those big factors, which are sometimes questioned in people who have not conceived spontaneously before, you've overcome those things in the past, so you could potentially overcome them again. So the next question, I guess, is, well, what are these possible causes? Tamara, you're kind of skirting around the edges here, but what are these possible causes that I've either had previously and they've worsened, or I got the odds, or perhaps that I've actually acquired or my partner has acquired over time? Well, they're quite widespread and varied. So let me try and clump them together. So let's say it's where you've played the odds. What I mean by that is you might carry some sort of structural arrangement to your chromosomes, or your partner might have something like a translocation where there's a crossing over of genetic material. Now, not every pregnancy is negatively affected by that. In fact, when you have a translocation, only about 1 in 4 or 25% of pregnancies will be abnormal, such that it ends in a miscarriage or doesn't even result in a pregnancy. And 75% of the time, or 3 out of 4 of the times, it results in a pregnancy and you never even know. So that's a pre-existing condition, an abnormal crossing over of your genetic material. So in you, everything is there, but in a potential affected child, not everything is there. And so therefore, that pregnancy doesn't result in a live baby. So that's something that could always have been there. What could it be if it's something that has been there but has reached a tipping point? Well, the obvious one I like to think about is endometriosis. We know endometriosis can affect pregnancy in lots of different ways. It can lead to adhesions, which can cause distortion in the ovarian and tubal anatomy. So just, with further development of that disease and further distortion, it could get to the point where the tubes become blocked with those adhesions. So that's something that might have been pre-existing before. Or you get to a point of disease load with endometriosis where there's so much disease and inflammation that it's then impacting on your ability for a little embryo to implant. So endometriosis is one of those things that can, I suppose, always be there, but gradually develop to a point where it causes secondary infertility. It could be something as simple as, and guys and girls are affected by this, but age. We know that women, as they get older, the quality and the quantity of their eggs actually reduces. So we know that live birth rates, particularly from spontaneous conception, reduce with age, and certainly falls off the cliff at around about the age of 37. So it's not an unusual scenario for a couple to come in having conceived easily in their early 30s, had maybe a few years break between children, and now into their late 30s they're struggling to conceive. So that's a definite big one, and that's both male and female. Male sort of more over the age of 40, 45, but women definitely from the mid-30s onwards. Or it might even be something that you have acquired. What do I mean by that? Well, it might be that you've developed an endometrial polyp in the lining, which sets up a sort of an inflammatory reaction, and implantation might be affected. it might be fibroids, it might be adenomyosis, which is the growth of the lining of the womb that goes into the wall of the womb. It might be that you had a D&C, or perhaps you had a cesarean delivery and a placenta that didn't come away properly, and you've developed some scar tissue like on the inside of the cavity. We call that Asherman syndrome. So all of these things have been acquired. In the male, it might be they've developed a varicocele, which is a swollen blood vessel that courses through the scrotum. Now that can cause increased DNA damage, which can affect the sperm quality and therefore the embryo quality as well. So it might be something as simple as that. I had a situation, and I'll never forget this case, where a couple conceived through ovulation induction treatment and then came back to see me 18 months later, unable to conceive. We thought it was to do with ovulatory issues in the woman. But in fact, when we did his semen analysis, it came back as no sperm, whereas 2 years earlier, he'd had a completely normal sperm count. And what we found is that he'd actually acquired or developed a prolactinoma, which is a benign tumor on the pituitary gland that was producing lots of prolactin, which subsequently led to a suppression in his sperm count. And so that was contributing to their inability to conceive. And that was something that developed in a really quick period of time, and he had relatively few symptoms. And then there's all these health things, obesity, smoking. We know women who smoke have an earlier menopause, so they might be reaching the end of their egg count. We know that men who smoke have an increased amount of DNA damage or oxidative stress, which affects sperm quality. So there's all these lifestyle things that with time people can develop that can significantly impact on their ability to conceive. So as I said, it is widespread. There are lots of things. And so it's really important. And this is, where I get to question number 4. How long, if we've had no problems before, how long should we keep trying before we seek some assistance? Well, the guidelines are exactly the same as if you hadn't been able to conceive with previous children. So if you're under the age of 35, 12 months of regular timed intercourse. So not just kind of, if we fall pregnant, then we're lucky. If we don't, oh well. Like proper timed intercourse for 12 months if you're under 35 for the woman. And then if you are over 35 as the woman, then 6 months, no more. And that's because time is of the essence. And if we are determining what we need to do, then nothing happens quickly in the field of assisted reproduction. I can promise you, you can't be impatient in this journey because nothing happens quickly. So we use the same guidelines. And then on to the final question. Question 5 is, well, what do I do? Like, where do I go to get started in looking for some assistance? Well, I would definitely start with your general practitioner, particularly if your GP has a good understanding of infertility, because they're often able to put those tests of those big rocks in place. They're often able to say, well, hey, you are or you aren't ovulating. What do your hormone tests look like? They might be able to do the tubal patency test. They can certainly counsel you on obesity. They can counsel you on smoking. They can counsel you on exercise. So starting there they can put the semen analysis in place. So starting there, I think, is a really good place to start, particularly if your GP has an understanding of infertility. And at womb we have a pre-fertility workup. That would be a perfect place for someone to start with our incredible women's health GPs. From there, I do think that you need to see a fertility specialist. I really think that you should be seeking the care of a certified reproductive endocrinology and infertility specialist, someone who has a deeper understanding of all the possible causes, someone who's going to really go into depth with you about some of the investigations that are required, and certainly will be able to counsel you extensively on what the right way to go, what is the right way to move forward with this. Because sometimes the concept of, well, I fell pregnant spontaneously before and then jumping to IVF is a massive jump for people. And I think it's really important that people go into that trusting that they've been fully investigated and they fully understand exactly what is required for them to move forward. And I think, it really should be someone who has studied this extensively and can guide you with the most amount of evidence base. So that's my little synopsis of secondary infertility. Hopefully one of your questions that, if this has been an issue for you, hopefully your questions have been answered. Thank you so much for jumping on here today, whether you've come on the replay or you have jumped on live today. If you think this is something that is really important for somebody else to hear, please don't hesitate to share it, tag them in, follow me. Next week, when we're in March, can you believe it? We're already into month 3 of the 12-month year. That's insane. We're already a quarter of the way there. That's amazing. We are reverting back to our rapid fire Q&A on Wednesday night, so I hope you are going to join me. Our guests that we were planning for this Wednesday just gone, we are going to have in the next couple of weeks, so do keep an eye out for that advertising. Thanks again for helping me to celebrate Feb Fertility, celebrating my 10 years of working in the fertility industry. You guys know that my passion is to help empower you with as much education and evidence-based information as I can, and to support you in the infertility journey. And I continue to do that, and I feel really blessed that you guys have connected with me and my community. Have a beautiful weekend. I'm off to celebrate and cheer for my hubby, who is about to swim to Rottnest by himself. With a team, of course, with a team of people around him, but he's going to do the journey solo. And he's an incredible inspiration to me and also our girls. So that's going to be my weekend. If you're at Rotto, come up and say hi. Otherwise, I will see you all on the flip side in March. Thanks for joining me. See you later.